This technique is really useful if you're getting any pain in your hips, particularly if you can't sleep at night because it's uncomfortable. It's also a brilliant remedy if you've got SPD, symphysis, pubis, discomfort. So what we're going to do is actually hold the pelvis into place, particularly to alleviate all the aching where the muscles have now become very soft and very lax due to the hormones of your pregnancy. So what you're going to do is take just a plain sarong, a shawl, a pashmina, anything like that will do, and you're going to take it out, open it out completely, and I'm going to just wrap this sarong around the beautiful Becky, and you start off, so if you turn around Becky for a second, that's lovely, all the way around, yeah. So what you need to do is you need to get the shawl or the sarong to start at the top of your pelvis. So Becky, you're just going to hold the front ends there. And then the bottom of the sarong needs to be around the tailbone. So that's just, you're just going to cover all of the pelvis, okay? So it's going to come all the way around here. Now what you'll notice is after you've done that, there's going to be bits of puckering, which isn't useful because you want it to be held really, really tightly. So Becky, you're going to come and face me, and what we now have to do is this gathering technique just to get all of the fabric to not be buckled and puckered. Okay, so if you just let go for a second, Becky. We've lost the whole thing. Oh, this works so much better when I do it. Okay, so you're just going to gather each little bit, just like you would do if you were making a ponytail with your hair. And you just gather it tighter and tighter, and then you do the same on the other side. And you're going to actually put the knot, you're going to gather this underneath your bump. So once you've gathered, it should start to feel quite tight. Is that tight, Becky? Does it feel like your pelvis is being held?
Yeah.
So you keep on doing that, pulling it until you've got no puckering. And then you're going to make this tighter around the pelvis. So what Becky's going to do is she's going to cross over the ends underneath her bump and hold one end in each hand. And then if you face the camera again, Becky, what you're going to do is every time you breathe out, pull your arms away from each other a little bit more, so you're tightening this girdle, this belt, okay? And then you're going to do that a few times. So every time you breathe out, you pull it a little bit tighter, and you start to feel everything being gathered around your pelvis. It feels wonderful when you're pregnant to have this support all the way around the pelvis. And then once you've done that about 3 times, it will be very, very tight, and all you're going to do now is tie a knot in the sarong at the front. It's going to go under your bump, so just tie that in any old knot that you can. You'll lose a little bit of the tightness when you do the knot, so you might have to just re-tighten it again and then tie another knot. Okay? So as tight as you can have it. And what will happen is as you move around in it, you might find it starts to loosen, so you might want to tighten it up again as the day goes on. Okay, and if you just do a 360 now, Becky, you can see this is containing all of Becky's pelvis. And you can wear this during the day. If you've got SPD, it's really comfortable. It's so much nicer than the elasticated belts you get from your physio. There's no compression to the baby, so the baby's fine. With SPD as well, the knot over the symphysis pubis actually provides a little bit of support if you're getting a lot of pain at the front. In addition to that, it's really nice for the hip pains that you sometimes get on the outside of the pelvis. And if you're getting them when you're sleeping at night, then you can actually put this on to go to bed in. Because the knot is under the bump and you're not going to be sleeping on your front, it doesn't get in the way at all. And a lot of my mums have found that they get a much better night's sleep once they've gathered their pelvis in and they've got this pelvic support. And if you get a nice pretty one, you can wear it out in the day and make it match your outfit, which we didn't plan this, but it's matched Becky's outfit perfectly. So that's one way of using a shawl to stop any pelvic pain, any hip pain or any SPD.